All right, we've been talking about this all week. The CDC warning people not to travel for Thanksgiving, and still more than 3 million people flew this past weekend. If you do decide to travel, can you do it safely? Dr. Richard Chaffoo is joining us now with the answer. Dr. Chaffoo, good morning. Did you get a haircut?
Good morning, Shally. I got a couple hairs cut, yeah.
It looks good, looks good. Dr. Chaffoo, we've been talking about this. A lot of people going to the airport. They are taking the precautions, the ones that we've heard from. What are the biggest risks right now about flying?
So, Shally, the biggest risk right now is just our exposure to large numbers of people. As you said earlier on, the big issue is that we're just going to contact more people, not only in the TSA lines, but obviously any of the vendors that we're in the lines, and obviously once we get into the airplane. And so the big problems are also that not only is contact with others, but we need to remember, as we've said so many times before on the show, that at least 40% of people that are positive for coronavirus are completely asymptomatic. So even if you have no symptoms whatsoever and you don't think to get tested to see if you're positive and obviously quarantining, a lot of people are spreading this unknowingly. And so that's part of the issue. Unlike the flu, if you got the flu in the past, of course, you would be ill and stay away. But this is not the case with this virus. It's much more insidious.
I just listened to a really good podcast, Dr. Chaffoo, yesterday. It was talking about the changes that the airlines did to the airplanes and with the HEPA filters, that they're getting air circulated in there so fast that the chances of getting COVID on an airplane, like you're more likely to get it at the grocery store. This is what some scientists and doctors and whatnot were saying than getting it on a plane.
I think there's a lot of truth to that, Shally, because we know now it's primarily a respiratory virus. This is the manner that it's that we transmit this as a virus. And so the HEPA filters, as you said, I mean, these are the same things that we use in hospitals, and they'll filter out 99+% of all bacteria and viruses. Although there's still some concern about it being on contact surfaces, that's probably a minor mode of transportation. And certainly, now there's much more disinfectants going. In fact, I was on an airline flight up to San Francisco last week and noticed that there's nothing in there's no magazines to read. There's still that the center seat is still empty. But of course, we're still not 6 feet away from one another in the other directions. But again, the HEPA filter being a major factor because this is a respiratory virus.
Right. And again, as I learn more about this and we listen to the experts who are telling us, they say it's not really the flight that's the problem, it's where you're going. You'll be safe on the flight if you wear the mask, you wash your hands.
Yes.
But where you're going, then that mask comes off, and that's when it's the problem. So some people are saying, you know what, we're going to skip the flight, we're just going to drive.
Yeah, that's not a bad idea, Shally. Especially if you think about it. I mean, if you're going to be traveling by car, you are going to, by definition, be limiting your exposure to other people and hence the virus. Now, however, if part of that changes if we're going to have a long road trip. If that road trip's going to be more than a few hours or say more than one day, then of course you're going to stay overnight in a hotel, you're going to be going to gas stations, restaurants, etc. Now you can see that you're increasing your risk of exposure to larger numbers of people and therefore statistically more likely to be exposed to this virus. So I'd say for a short trip, for a day trip, for a trip that's just a 1 day trip, yeah, probably driving by car, you reduce your risk. Something longer than that, you need to rethink that. You're probably, in a sense, better off flying if it's going to be a several-day trip, or certainly a trip where you have to stay overnight in a hotel.
CDC warning people, and they're asking for people not to travel and to please stay home. I think my brother, who I see every single year, we made that decision for him not to make that trek back from Atlanta. Just because we're getting so close. We feel like we're getting so close that it's not worth it. But we did hear from a gentleman earlier today, because there is this emotional need, Dr. Chaffoo, that we're fighting as well. And the gentleman said, I need this. I need this emotionally. So is there a way to do this and do it as safe as possible? What are those things that you if you're going to do it, you just got to do these things on top of it, even though it's better to stay put, according to the CDC.
Right, you make a great point. And we're still, we're still humans, right? We're still very social. So if you're going to make this trip, it's a very important part of our culture. Getting back together with families, as you said with your brother. Remember the face coverings, as we've talked about. You and I have talked about so many times before. Face coverings, trying to maintain that social distancing. Obviously, washing our hands frequently. Try to avoid touching your face. That's part of the reason we have a mask. And then look for apps where the actual check-in is hands-free. Think about bringing your own food and your own drink. Again, that just reduces your exposure to other people. And don't forget bringing along those sanitizers and wipes for areas that you might just feel more comfortable if you're wiping those off yourself.
Yeah, we might have to adjust this Thanksgiving, but next Thanksgiving, I want to make 5 turkeys, 10 turkeys.
Yes,
invite the
I
whole
hear you.
block
Me too.
over. Dr. Chaffoo, thank you
We'll
for
have
your
a
time.
vaccine next year, and I think things will be a lot better for all of us. But this year, we all just need to really be very safe.
Yes, I agree. We appreciate the advice. Happy Thanksgiving to you.
Happy Thanksgiving to you.